Hello, welcome back to the Bioanxiety podcast. On today's episode, we have the wonderful Dr. Pam, who is a psychiatry doctor in training. And I've known you for a little while. I've known your journey. I don't know all the parts of it, but I will let you take it away. So.
Sounds good. Well, thank you for having me on your platform, Juicy. So I am a psychiatry resident in training, meaning that I was a pre-med, went to medical school, and now I'm here in the final years before I can be a fully licensed doctor in training. I have 4 more years left to go. So I'm doing this training now. It's my first year, and I think in the very beginning, it's been about a 20-year journey for me almost. I say it that long ago because when I was in high school, that's kind of when I started like thinking about being a pre-med. I was very influenced by my family in the beginning. Both of them were doctors. I grew up around a family of doctors, but over time, like I found my journey and my why into why I should go into medicine, not just because I have other family members going in. Um, so throughout college, it was pretty cookie cutter for me. I was a pre med at UC Berkeley. I studied molecular cell biology and neuroscience, all this pre med scientific stuff. And then I realized that, starting to apply to medical school wasn't so straightforward, actually. And that's sometimes a misconception for a lot of pre meds. You have to mold into this very heavy science background, get a lot of good grades, score really, really high, and then it's smooth sailing for you. I realized really early on that it's not that easy. And this is also how, early stressors and my own mental health journey just kind of came about as I was going into medicine. Um, so it was challenging for me. When I was applying to medical school, it took several years. I took gap years. I applied to both the US and abroad as well. And what played for me in my cards was actually going to the Philippines for medical school. So I spent 4 years there, plus COVID actually kind of.
Oh, yeah.
COVID was a crazy time when I actually spent some time back in the States and had to do some clinical hours online in the Philippines time zone. A lot of stressors just to get to where I am today. And on top of that, every year I always thought like, do I really want to keep going? Do I really want to be a doctor? What's the point of all of this stress? I see my friends and family are already working, and I just feel like a student, and I'm never going to get anywhere. But I think just having such a unique journey and going through these years of challenges and really having hope and support from my community. I'm such an advocate for like really working towards these difficult challenges through your life and getting through them because it is worthwhile. And now I'm on the other side and now a resident doctor, and it's still really, really hard, especially in the first few months. But now I'm finally there, and I'm so happy that I went through all of this. And going into psychiatry, like being a doctor for mental health and psychiatric illness, I do feel like I'm kind of in this space that is the most meaningful for me in medicine.
Yeah, that's what I was gonna ask you. Like, why psychiatry, right? Because obviously there's a lot of different areas that you can go to in medicine. Like, why specifically psychiatry for you?
There's two parts to it. So I think just with my own mental health journey, I really early on just kind of understood the struggle it takes. There's stigma around mental health and seeking support, and also just understanding that there's so many resources out there for people for their mental health. And if I didn't seek out these resources, I've had my own psychiatrist, I've had my own therapist, I have had many resources in the wellness space. If I didn't seek any of these out, I honestly wouldn't be where I am today in residency. It's such a struggle, and you need the support. And I think, you know, aside from my personality, just having this experience now, makes me just so much more excited to be specifically in a field in medicine that works towards people's mental health. Um, on top of that, I just also think that psychiatry has a very creative aspect to it. I think find myself to be more of a creative person rather than scientific. That's why part of the reason why I, always thought like, should I really go into medicine? But psychiatry kind of draws on that because there's not as many objective measures to finding specific mental health diagnoses. And you really have to understand and look into a person's life to find a diagnosis for them, to really work with them. It's not just looking at their labs and saying, oh, this person has XYZ, they have this diagnosis, let's give them this medication or whatever treatment. There's just so much more involved, and it requires a lot of empathy and understanding. And I think it fits my personality because I like to listen. I like to really, understand a person at their core. And then now being a physician, I can be on that level where I can rule out, is a mental health problem caused because of a medical illness, or is there really a psychiatric underlying diagnosis. And I can also understand what treatments, whether it's medication, whether it's therapy or other resources, being the physician will helps me to understand it from a really big picture. So
I mean,
yeah.
that's also, I mean, obviously, like, we live in such stressful times, right? Like, I feel like in the US, we live to work.
Yeah.
And I know, like, I meet a lot of stressed people, and it's amazing. Like, I know you know how to connect with people really well.
I try.
um, so now that you're in residency, we finally got there. how does how does your day look like? Like, what is like your typical day at the hospital?
Yeah, it's unpredictable and it's different every day. So currently, for your first year of residency, you have about 6 months, at least for psychiatry, you have 6 months where you do something off service. So I also have to, because I'm a medical doctor, I have to have rotations in internal medicine, neurology, emergency medicine, just so I get a well rounded experience and training before I just kind of dive into psychiatry for the rest of my life. But right now I'm on inpatient psychiatry. So yeah, it really is. It changes every day. But in the hospital that I work in, we both have voluntary and involuntary units, and I'm in working in an acute hospital setting. So basically, the people who come in, the people that I meet every day, they're going through a really tough time in their lives, and at that point in their life, need acute stabilization. So usually these patients, these people I meet, they're going through something where they can't function safely in the community. They're either a danger to themselves, others, or property. So sometimes we, have to determine, should we hospitalize someone on an involuntary status, or people who are going through a rough time but don't uh, meet these requirements for involuntary will try to get hospitalized just so they can seek treatment on a voluntary setting. So I see patients every day. There's not as many diagnoses within psychiatry. There, it falls under specific branches, specific categories, but every presentation is different. We have mood disorders. There's depression. There's bipolar disorder, schizophrenia. Anxiety, and every single patient is completely different. And I find it to be so fascinating because you have to really talk and listen to a person, understand their life, where they're coming from, and not just like look at their labs. And yeah, it really is so different. And at least the hospital that I'm in, a lot of patients are coming in every single day. So honestly, I have like over 13 patients right now, like on my list. And for a resident, at least me starting out my first 2 months, to me that's it's a lot to
That's a
handle
lot.
right now. So that's why I also just appreciate platforms like yours, because I'm constantly looking for, motivation, inspiration, and resources, even as a medical doctor, to work on my self-care and anxiety, like my own anxiety, because I find myself to be an anxious person. I've always been like that. um, and having these resources are just so helpful in such a it can be a hectic environment that I'm in. So
I mean, it
yeah.
must be also so rewarding though when you have patients and then you see them get better, right? And like,
Yeah.
yeah, mental health is uh, like it's in. I love like how we have a lot more resources now,
Yeah.
and obviously we need to get them out there because a lot of people don't even know that these resources are available.
Yeah.
um and you're right, there is so much stigma. Like I literally grew up like, oh, if somebody sees a therapist, they're crazy.
Yeah.
Like, and it's still kind of like that in Italy, honestly. Like whenever like I've told my family like, oh, I'm seeing a therapist, and like people that are, like live in Sicily who are like backwards, they'll look at me like, what's wrong with you? Like everybody needs therapy, I'm sorry, but like
Yeah.
um so what kind of advice would you give to like I don't know, like a high school student or somebody who's just in general, people that are looking to go into medicine, like
Mhm.
how would they look at resources? Like, how did you look for schools? Like, what were you looking for in a program for
Mhm.
yourself when you decided that you wanted to follow this path?
Yeah, so the biggest thing, is finding the community and support. And I know we were talking about this earlier, how important it is to just have a solid support system for whatever career path that you're going through. But especially in medicine, at least, with my experience, I would not be where I am today if I did not have the community who have already like gone through the steps, but also can kind of support you along the way. So, in terms of looking at schools, there's a lot of resources out there online. Every, university program, as at least for high school and college students, there's advisors that will kind of lead you along the way to find different schools. My biggest advice is, don't be so narrow-minded into thinking that there's just one path. Honestly, it's especially in medicine, it's a windy path, and it can, some people might just go one linear trajectory where they go straight from high school, college, medical school, residency, become a doctor. But honestly, in most cases, that's not how it is. And for me, that's not how it was. I spent multiple gap years trying to figure out the system. I traveled abroad and I lived in a different country, though I have a lot of family there. Lived in a different country to study medicine and came back, and the process to get to residency was so windy. But what helped me succeed the most was planting seeds everywhere, not closing off doors, and just trying to like appreciate the uniqueness that you have in your journey. And yeah, having that support, like having people around you to kind of help push you and give you that inspiration that, okay, you're doing the right things even though it's taking years at a time. Like, you're going to get there. And that's where I am today. So
I mean, community is very important, and
yeah.
it's also, so important to have people that support you and push you. Because, I mean, I don't think I could be a doctor. Like,
it's
it sounds like a lot of years.
it's a lot. I know. When I said, when I prefaced, I was like, I've been in the medical track for like 20 years. Seems like a long time.
Yeah.
But honestly, a lot of ups and downs. I mean, at some point, even in my fourth year, and this is why I emphasize really this. It's a non-linear path. I my fourth year of medical school, I almost dropped out. Like I wanted to leave. I don't know even know if I've
No,
told you.
no, I don't.
I just did not see the clear path for me to go to residency, because I've always been like I wanted to be a clinician, but also like I'm creative. I am very interested in innovation and how technology is implementing in like healthcare systems. I actually started, and maybe because I'm also influenced by all of my friends in tech, I started like looking into software engineering and design, and like maybe I can find myself, working in industry like for healthcare products. So I started kind of looking at that while I was like in my fourth year of med school. I tried to learn how to code a little bit even
Don't do it.
while I was studying for like my USMLEs. Yeah, it was a crazy time for me. But what kind of drove me to get my MD and like go to residency was, this path to actually become a physician, get my MD is just going to provide me so much more flexibility. I see myself maybe not working in hospital setting for the rest of my life, but I see myself also like blending with industry, being the clinician expert for like new healthcare products that are trying to improve processes in the healthcare system, because we really need a lot of improvement in a
Yeah.
lot of these areas. And I'm noticing that now, as a resident, there's the burnout rates for physicians are very high. And one thing, that could be improved upon is just our workflow and the way that we work and we document. Things are still archaic, but it's crazy because we have so much technology out there, that can, in theory, support and help these processes, but just not there yet. But I want to be on that, the front lines of that, and help create discussion and conversation about how to improve these processes for physicians.
Yeah, and I think that's amazing. Also,
Yeah.
like, you're right, like we have so many technologies that could be used in hospitals. So like AI, like you could have somebody taking your
Mhm.
notes for you, because I know you guys like have to take a lot of
Yeah.
notes and stuff like that. So you mentioned some anxiety and burnout. How do you like, what do you do to manage like your own anxieties? Like, do you have a specific routine for your self-care, for your mental
Mhm.
health?
Yeah, so, throughout the years, I've dabbled in so many mental health resources. So, my biggest advice for anyone out there is really just understanding the breadth of resources out there. It's not just medication or therapy or, whatever other wellness resources are out there. There's so many, and it can be different per person. What I found to be the most helpful for me is a blend of, things from each category. I am a strong advocate for therapy. I think it's important to be able to talk about, things that are going throughout your day, and also understanding how can you, reframe maybe negative thinking processes. How can you use the anxiety that is so natural, in your body? How can you use it to actually help you rather than hurt you? I think that's important. So therapy, I have my own therapist. In the past, you know as a doctor, I'm not providing any medical advice to the community here, but I've also had experience with medication too. So if that is something, that you are interested in, or you feel like, you know there's something, you need a little bit more help in that direction, there's psychiatrists out there that you can look for those resources. But the most important thing now that has helped me kind of maintain a good, like, stable, good baseline with my anxiety, is just changing lifestyle factors, from physical activity to sleep to my nutrition, social connections, and then limiting, excessive substances, whatnot. Just having that blend, trying to understand how you can improve in those areas, because in life in lifestyle medicine, those are kind of the pillars that, if you improve on those, it just can help not only your overall health, but there's a lot of evidence that, improving those areas in lifestyle can also improve your mental health, and prevent psychiatric illness. So physical activity for me has always been the biggest one. I love movement. I've uh, studied and taught yoga over the years. I find myself to be a very fluid and moving person, so I'm always trying to do something to kind of better my body in that way. So usually what helps me the most is going out for walks, trying to take some time out of a busy schedule to stretch a little bit, maybe do something, make small improvements in my body where I can, start to do something that's I didn't think my body could do before. So for example, right now I'm like working on handstands and flexibility, like all this like kind of like calisthenic stuff, and that's just my, like personal interest. But over time it's like something that I have found to be so like, I guess, just really fun to have, work on something like this and see the progress. And it's it feels good to know that like I can actually like improve my body in these ways. So yeah, having those like little lifestyle factors has been the best thing for me.
I mean, exercise is so important.
Exercise
Can
really
I
is.
mention that you
Yeah.
also taught a core power yoga?
I did.
Okay.
Which I miss it. I miss the community there so much. I know you've
Yeah, I
recently been
recently
going.
started core power yoga. Like Mickey dragged me. It is amazing. I have to say, like,
Yeah.
definitely one of my favorite workouts that I've done so far. Thank you. That was amazing. I'd love to hear. Maybe I'll try some handstands too.
You
My
know,
balance is not great.
honestly, like the practice of inversions, it's just so it's also a mindful thing. Like I think maybe it's part of like my like type A personality. Like I like to be in control of things, but you know, learning how to be in control of your body in like these different ways has just been so motivating for me to keep. It's inspiring actually when I can see myself like actually getting into a handstand or a headstand even. Yeah, like something about this like mind body connection is just, it's therapeutic.
Yeah, I don't know if I can still do. I can definitely do like 3 cartwheels in a row.
That's that's way better than what I can do actually.
It's a skill, I'm telling you.
You have to teach
I
me.
will teach you. um, so I guess as one final question, is there one piece of advice you would give your younger self?
Feel like I can give my younger self so much advice, but maybe the biggest one is all the good things, in your life is going to take time. The best things in your life are going to take time. And even if you can't see the clear path to get there, keep planting seeds, keep opening doors, have that support from community, and the best is yet to come. And don't give up, because nothing good in life, was easy. So yeah, it really does take time.
Thank you. It was so nice to like learn more about your path. Actually, I mean, I know I've known you for quite a while, but it's just always nice to like learn more.
Yeah.
Well, thank you for doing this, and
Yeah,
it's gonna
thank
help
you
a
for
lot of
having me
people. Yeah,
here.
and yeah, thank you, everyone. Goodbye.
Bye.